Welcome to North Tees and Hartlepool Voices, telling the stories of our people and community in our trust.
With me in the studio this morning, I have Paul and Lindsay from the Volunteers Department. Why do a podcast now?
We're always looking at ways to reach out to volunteers and our wider local community. Currently have seminars for volunteers, drop-in sessions, we have newsletters, we have other ways of contacting our volunteers, going right back to the basics of phoning, emails, that kind of thing. But I guess this is an attempt for us to reach into the way that people pick up with podcasts. So it's this is the start of us to embrace the modern era. It's a new, innovative way of getting our message out.
Lindsay, what were the highlights of last year?
So some of the highlights for us were that we recruited and inducted 152 volunteers. Our volunteer drivers also supported nearly 5,000 patients from either taking them home from hospital, bringing them in for outpatient appointments or delivering medication or equipment out to them in the community. 2023 also saw the introduction of the Volunteer to Career pilot in the Trust. So from April last year we've been able to support to date 14 volunteers to develop their skills and experience and gain employment within the NHS.
And what are we looking forward to in 2024?
More of the same, really. We've got our thank you event arranged for June this year. National Volunteers Week is 40 years old this year, so we're going to do something a little bit special. As a trust, we have a new chief executive, or recently appointed chair, and other senior managers, and we're hoping that all will be there with us to celebrate. We'll have some entertainment. Catering will be top-notch as ever, and it'll be a cracking night, so always looking forward to that. Always work really hard, but to see the sort of the benefits and the sort of the appreciation of the volunteers is really something that I look forward to. Student Volunteers Week was a few weeks ago. Look forward to that because as a trust we're trying to encourage as many students to get involved as volunteers as they start to build their career and develop as people. I've got to say, one of the highlights for my year is the session we put together just before Christmas where all our volunteers come together and wrap all the Christmas presents for all the patients that are in hospital on Christmas Day. That's a great event. Love that. And I suppose from a trust point of view, what I'm looking forward to is sort of developing our team a little bit further. We've got some plans to grow our Volunteer to Career programme, which is helping people move into employment within the health and social care services. We're looking to implement the Investors in Volunteers, which if you are from a human resource background, you will be aware of the Investors in People, which is a structure around how well do we look after staff. The Investors in Volunteers is a structure around how well we look after volunteers. I guess the bottom line for me is what I'm looking forward to is recruiting more volunteers to help and support more people of our local community.
So how can people help?
Very easy. If you have a few hours to spare, you'd like to help some people who are possibly a little bit less well off than you or definitely more vulnerable, and you'd like to contribute to your local community, get in touch. We have a phone number 01642 383 933. There is a website. Go onto the Trust website. It will lead you to just type into search volunteers, and there is other email sort of addresses to put in there. Just contact us, and we'll give you all the information you need to sort of decide whether volunteering within the hospital is for you and how you can do it.
And I think lastly, what do volunteers get involved with within the Trust?
So we've got a variety of roles that volunteers can get involved with. The first being volunteer welcomers. So they are the friendly face at the main reception areas, and they will meet and greet people coming in. Just make sure that they know where they're going and just take them to their appointment or department the quickest way possible. We also have a group of clinical volunteers who will provide support in the ward areas. So they will chat to the patients, keep them company, they'll assist during meal times, encourage the patients to eat and drink, and generally just try and make the patient's experience a little bit better. We've got a volunteer driver role, so they will take patients home who are being discharged from hospital and also bring them in for outpatient appointments. And then we do have a group of discharge support volunteers as well. So they help patients who are going home who are at risk of loneliness and isolation, and they'll just generally keep in touch with them after discharge. They'll signpost them to other services and organisations in the community and just check in with them and check that they're doing okay after the hospital stay.
And all the information that he needs on the Trust website?
Yes.
Well, Lindsay and Paul, thank you.
Thank you.
Thank you.
Thank you for joining us. Till next time, you've been listening to NTH Voices.